Thinking about launching your own line of treats? You're in good company, and honestly, there's never been a better moment.
That's right, because private label is exploding. In the US, private label pet care hit $5.5 billion this year, up 2.4%. And that wave is only getting bigger. Retailers aren't waiting for national brands anymore. They're building their own.
And globally, private label isn't just growing, it's taking over. In places like Portugal and Hungary, private label pet food holds over 70% of the market. Here in the US, more than 80% of consumers say private label matches or beats national brands. Translation? Customers trust you just as much as they trust the big manufacturers.
Which makes treats the easiest entry point. Fast margin, low risk, instant brand recognition, and customers love seeing your logo on something their dog already enjoys. That's where Aardvark shines.
Aardvark keeps minimums small so independents can actually compete. No massive buy-ins, no complicated setup, just high-quality treats professionally labeled with your brand so your shelves look polished and premium on day one.
And because you're listening to the Pet Shop Girls, your $600 setup fee is waived. Plus, you'll get 10% off your first order. Just tell them the Pet Shop Girls sent you.
Go to aardvarkpet.com and get started. Aardvark Pet Products, where your brand begins.
Pet Shop Girls, the voice of the indie, the heart of the trade. Pet Shop Girls, unleash your power, let's make some waves.
Hey everybody, I'm Sherry.
And I'm Carly.
Welcome back to the Pet Shop Girls podcast. In preparation for Pet Dental Month, we have a special guest today. Dr. Katie Kangas is an integrative veterinarian who blends science with holistic care to support whole body pet wellness. After years in traditional practice, she shifted her focus to nutrition, dental health, and natural healing strategies. Her work at the San Diego Humane Society sharpened her skills in prevention and rehabilitation, leading her to create Dr. Katie's Remedies, a trusted line of natural products. Her mission? Help pets thrive and give pet parents practical tools to support vibrant, pain-free lives. Welcome to the podcast, Katie, Dr. Katie Kangas.
Yeah.
Thank you. It's such a pleasure to be here. Really happy to contribute for your listeners and the industry. There's so much to talk about in the dental topic, and it's certainly one of my passions. I have many, but it is one of my big ones. So really happy to be talking today.
Yeah, we like that your passion is aligned with not only ours, but many of our listeners as well, to help pets thrive and give pet parents those practical tools to support their overall health and well-being. I would say that that's why the majority of us got into this business. There might be some out there that thought, I'm going to open a pet store because it'll be easy and fun. And then, and then they did. And they realized not so much.
I wanted to jump in real quick before we get into the nitty gritty here and say, look, as a pet store owner for 20 years, I've known that, dental health is important because there's bad breath and, stinky teeth and, their teeth could fall out. But beyond that, a lot of retailers don't really know what to recommend, what are effective products, what to look for in a product. And we're going to get into all that and more to help you help your customers.
Yes. So let's start here, Dr. Katie. You are known for saying that the mouth is a mirror for the rest of the body. And so can you kind of explain for our listeners how that oral inflammation affects the other parts or organs of the body?
I am so glad you started there, Carly. That is such a good starting point and launching point for this discussion, because as an integrative veterinarian, once I learned dentistry, and I will say that 10, 15 years ago, I sort of fell into really getting a deep dive in veterinary dentistry. Yeah. And it turns out when I opened my integrative practice, I actually leased space within a veterinary dental specialty practice. And so by proxy, working there for years and being very close friends with a lot of the boarded dentists there, I ended up learning so much about dental health from the conventional side of medicine. And then coming with my integrative background, going, wow, this is so monumental to whole body health. And I love to tell my clients, you or your pet cannot be in good health, good whole body health, if you are living with poor oral health.
Right.
And literally dentists or, all the periodontal, research data has coined the phrase that periodontal disease is the silent killer.
Yeah.
Because most people don't realize, especially with pets, perhaps until the breath gets really bad, et cetera. A lot of people don't even know that it's happening, or at least to the degree, because so much of it is happening below the gum line where we can't see it.
Right.
So not only is it often like undetected or, not as recognized as, a big of a deal as it is, but importantly, as you said, it is affecting every single organ in the body. It is driving inflammation. It's a constant bacterial load that the body has to, fight off and use energy to deal with. And it causes fatigue in the body. And it's really interesting that when we see when dentistries are done, especially with the board certified dentist, but any well done dentistry, when a pet has a dental issue, a lot of times the pet parents don't even know. But after the teeth are addressed and the dentistry procedure is done, when they come back for the 2-week recheck, one of the most common things that the doctors get to hear is, oh my God, my pet is acting 5 years younger or 10 years younger. It is absolutely amazing. And we know that this chronic source of inflammation and bacterial load is actually fatiguing. So when a lot of people say, oh, my pet's aging, or if somebody's coming into your pet store and, my pet is just slowing down. And there's a lot of reasons for that. I mean, there's a lot of stuff going on in the body, but dental disease is absolutely something that will, quote unquote, slow a pet down and have them age faster or seem older than they are. And so I love people to think about the mouth when they think about their pet's energy level isn't as stellar as they think it should be or hope it would be. So that's something. And then the other thing about you mentioning all these organ systems, which is really great to explain to everybody, is most people understand that periodontal disease and, the inflammation and bacterial load from the mouth is traveling through the bloodstream to the heart. Certainly everybody knows about heart disease with dental disease, kidney, liver, et cetera, the main things, but main organ systems. But a lot of people don't realize that dental disease has been shown to be a driver of IBD, inflammatory bowel disease, brain issues from, cognitive dysfunction in dogs or Alzheimer's in humans, and, even arthritis, even general, generic arthritis is that inflammation in the joints is being promoted, more consistently and chronically if there's inflammation in the mouth, just showering inflammation into the body all day long.
Yeah.
Wow. That's kind of scary. Oh my gosh.
Right? It is. It's like monumental. And so I love to tell people that investing in your pet's oral health is such an incredible investment. It is literally affecting the whole body and, and adding to longevity, honestly.
Yeah. I often say to my customers that they always say that the eyes are the windows to the souls, but the mouth is the gateway to health. That's what I say when it comes to our pets.
Yeah.
So if we're, especially if you're a grooming salon, okay, and you're looking at the dog and really any retailer has dogs that come into the store, what are some signs of dental issues? And you said earlier that usually we catch it too late, right? So are there signs that us as retailers and groomers can be trained to spot when talking to customers?
Love that question, Sherry. So this is great for retailers and great for retailers to educate clients on this, is that one of the myths, I love to talk about like the top 5 myths of veterinary dentistry. And one of the myths that has been believed for decades is that tartar, that calcified, what we call calculus, calcified plaque on the teeth, which shows up as, the brown looking like dirty teeth.
Yeah.
The tartar or plaque is not the best indicator. The level of tartar or plaque is not the best indicator of the level of dental disease. The best indicator that we can see without getting under the gum line with probes and dental x-rays, the best indicator is gingivitis. So gingivitis, which is inflammation of the gums, which is going to show up as swollen gums, reddened gums, sometimes even purple line on the gums, that kind of thing. Once the gums don't look healthy and pristine in color and, sort of characteristic, you've got dental disease. And that can happen either way before tartar and plaque, or it can happen sort of what you would think is incongruently. And by that, I mean that you can have a pet with heavy levels of tartar, and you pick up the lip and look in the mouth and you're like, whoa, look at all this tartar there. Oh my gosh. But the gums actually still look pretty decent, quite good. And on the flip side, you can have a pet with very little tartar and the gums look awful. And that pet is screaming with dental disease. But even veterinarians to this day, I mean, I think newer, more recently graduating veterinarians are hopefully hip to this. But for years, we got lack of dental education in veterinary school. And I graduated 30 years ago, right? So unless you're doing a lot of continuing education, you're not up to snuff on this. And a lot of veterinarians even will look in the mouth and see not much tartar. And they're like, oh, mild dental disease, yet the gums look awful. So that is a really good tip for people. And then clearly bad breath is pretty much a sure sign. And there are a couple other reasons that dogs can have bad breath. So I'll just shout this out because it's cool information. Is that also gastric reflux and GI issues? If there's constantly reflux coming up from the stomach, and a lot of dogs suffer from GI issues. So that can make their breath really bad because there's junky smell coming up from the stomach. And then advanced kidney disease. So this is not one that we see that often, but advanced kidney disease, toxins are building up in the bloodstream. You get uremic. And then those toxins the mirror to the body, come out in the mouth and the breath. And that can be another thing. But by far, statistically speaking, bad breath most often is going to be coming from periodontal disease. So that's, a really good tip too.
Sherry, when I first opened House of Paws, I was spending way too much time making documents that I needed from scratch. Employee handbooks, sales games, event planners, even little giveaways for customers.
I remember, and those weren't just nice to haves. They make your store run smoother and kept your customers coming back.
Exactly. Every document I created was because I needed it for my own store. And then I kept hearing from other pet pros, I wish I had something like that.
I said that too, and that's what I love. These aren't theory. They're used in a real store with real results. I use your event planner every month. And now any indie retailer can grab them, save time, add their logo, and use them too.
Right? So if you're tired of starting from a blank page, check out houseofpawspetpro.com and use promo code PetShopGirls to get 10% off your first order and see which documents can help you get your time back. So in my store, I try to encourage our pet parents just to make brushing part of your daily routine. I always tell them your, raw meaty bones are Mother Nature's toothbrush, but we can also help that by making sure that we're brushing every 24 hours. However, lots of pet parents struggle with daily brushing for one reason or another. So if for our pet pros who are helping guide these pet parents, if brushing isn't realistic, what kind of holistic or natural alternatives would you say actually move the needle when it comes to keeping the oral health good?
Oh my God, that's such a good question. And there are so many things that we can actually talk about in, answering that question in that category. But, being integrative and holistic, I love to start with nutrition. So let's start there, and then we can get into other things that people can do. And I'm just going to back up and say, agreed, that brushing the teeth is kind of a gold standard of dental health on the human side and, the pet side. But it's a tall order for a lot of pets, and some people are obviously going to struggle to achieve that. The other thing that I'll just throw in there about brushing the teeth is that most of the data, the studies suggest that if you're not brushing the teeth at least every other day, every day is best. But if you're not doing it every other day, meaning you're doing it once a month or twice a month, it's really not.
There's no point.
There's no point. I mean, it's not enough to, be worth the time of doing it. So, so I just want to throw that out there. Nutritionally, I'm sure all of your listeners are hip to this, is that processed foods are going to drive more dental disease. And of course, there you go. There's one of my
That's
other.
the big one. Yeah. And well, back in the day, they used to say that kibble, because you crunch on it, helps clean the teeth. But I always tell customers that, that's like us eating a pretzel and saying, oh, my teeth are clean.
Yeah. I know Sherry uses a pretzel because it's healthy. I always say Doritos.
Yeah.
When my customers come in, I'm like, if you ate Doritos every day, does that mean you don't have to brush your teeth?
Exactly. So, that is absolutely one of the top 5 myths, is that dry kibble will help dental health by, cleaning the teeth, which that kind of ties into the other myth about gingivitis and plaque not being the best indicator of periodontal disease, is that gingivitis is the starting point and the issue that progresses to severe periodontal disease. And the point is when you eat standard dry food kibble, it is not rubbing on the gums and helping to gently abrasive, get stuff, it's not affecting the gum line, or certainly below the gum line. And so dry food is actually not an asset to cleaning to dental health at all. And then one step further, if it's processed, and another step further, if it's high in carbohydrate, which i.e., sugars, feeds the pathogenic bacteria. The most bacteria that wreak havoc in the body are sugar lovers, by the way. Yeah. And so obviously that rings true in the mouth as well. And so once you get all that going on with processed food and high carb and all that, and the processing causes more inflammation, you guys probably are aware of the inflammatory triggers, AGEs, advanced glycation end products in dry foods. So all of that's just driving more inflammation and then more bacterial load. So that is a great thing to talk about. And then on the flip side of that, of course, species appropriate raw food, or at least, fresh, minimally processed food that is species appropriate ingredients and ratios with low carb, then you already set the stage for better health. Yeah.
If somebody was feeding raw food alone, like since birth, right? Because of the enzymes in the meat, would they ever have to have the teeth cleaned? And would they still have to do teeth brushing?
You know what is so cool, Sherry, about you asking that question? The way you phrased that question, there's actually a nuance in there, which is pretty remarkable. And what I will say is, maybe I'll answer the broad question first, and then we'll dig into that little thing that you said about since birth. Because this is new. Like, I just read a study on this, which is so cool. And it's from Dr. Anna Bjorkman out of Finland. And she's one that Dr. Karen Becker has quoted with a lot of raw food studies and stuff. And she's actually, there might be a couple other researchers on the paper, but she's definitely one of them that studied, well, I'll just get into the age thing, that if dogs are fed raw food from the get-go, that they literally later in life have far less calculus and plaque scores and gingivitis scores. So even if they're switched to, I don't want to, say it's anytime you're going to switch your pet to raw and fresh food is obviously good. But even if pets were switched over later, there was still a reflection of a difference in dental health of dogs that started out on raw and dogs that didn't. That to me is that to me was actually surprising. But then to sort of get to the broader part of that question is absolutely, if somebody is feeding fresh food and certainly raw food, that is the most appropriate for their bodies evolutionarily and, continually. And so, and with the raw food, of course, you don't have the processed component, you don't have the high carb component. And importantly, it's got the fresh, viable enzymes in there that is also going to work in the mouth and helping the mouth. So it's just a win-win-win all the way around. And then the chewing items, and we can get all into chews and stuff, but the raw meaty bones, as I think Carly was talking about with, stuff actually rubbing on the raw meaty bones, like chicken necks, turkey necks, etc. The teeth really have to sink in, unlike dry food, unlike kibble, where they swallow most of it without even chewing. That's not like, how's that cleaning the teeth? They don't even freaking chew it. It's too small. And with a raw meaty bone, their teeth literally have to really sink in there to chew that and grind that down. And then it is rubbing up on the gums, and it is providing a nice little gentle abrasiveness on the enamel of the tooth to keep wiping off the plaque. And we didn't talk about plaque. I love to define plaque for people. So if you want me to go there, I would love to say that too. So people understand like what's happening on the tooth, what's causing all this.
Yeah, go for it.
So, okay, cool. So plaque, I literally do when I do my talks or my presentations, I'm like, Tooth Anatomy 101 and definitions. And because people don't even really know what is periodontal disease, like what is that? And so the definition of plaque is a bacterial biofilm. So, and it's this bacteria in the mouth, and they create this little gooey matrix we call a biofilm. And once it's like stronger together, stronger in numbers. And once they're in this little matrixy biofilm, they're super hard to get rid of with, antibacterials and stuff like that. And the best way to get rid of a biofilm is to swipe it away mechanically. And that's where that beautiful abrasiveness, comes in, or, and gentle abrasiveness. We're not, scraping on the teeth. And a soft bristled toothbrush, again, is that little abrasive, gently abrasive thing that is wiping away the biofilm.
Would a bully stick work? And I know that raw meaty bones are the best. I just want to establish that's like the nature's best dental chew, because it has the enzymes in it and everything. But if somebody didn't want to do that, would chewing on a bully stick help? Definitely
will help. I don't know if there's been any studies done. I haven't seen any on like different items, exactly what that would do. I am quite certain it will absolutely help. Will it rub on the actual enamel surface of the tooth as much as a raw meaty bone? Probably not, but it is rubbing on the teeth, and depending on how the dog chews it, how long it takes them, other factors, but it's got to be providing some benefit in just even that mechanical removal piece of it. But on the flip side, we also, and we can get into this in greater detail now or later, but we also want to take into account that there are things that are at high risk for damaging teeth. And that's a big deal. And, the data is that there's at least 1 out of 10 dogs walking around has a broken tooth in its mouth. So 10% of dogs have a broken tooth. And historically, veterinarians, again, trained 30 years ago, a lot of veterinarians are like, broken tooth, not a problem. Don't worry about it. Just watch it. And veterinary dentists are like, watching it is not a treatment strategy. Not good. Because a broken tooth means that often if the pulp is exposed or the root canal, sometimes it's just the dent in the middle layer between the enamel and the root canal that's exposed. Either way, it's painful. It's at very least sensitive. If the root canal's exposed, it is darn right painful. And it's an open avenue to infection. And they call the root canal, the pulp cavity, a super highway to the bloodstream.
Well, and the immune system would be constantly activated.
Yes, you are so right. And eventually a broken tooth can abscess. And then it's a huge problem. And talk about pain. I mean, a dental abscess is miserable. And there are a lot of dogs that suffer from that. And so if we leave a broken tooth in the mouth, that's, the path you're heading toward.
So I know you wanted to talk about chews. What chews do you find best besides raw meaty bones?
Awesome. So perfect question. So then I'm going to jump back to the bully stick, comment. So just to clarify that is that bully sticks statistically are rarely seen to break, at least known to break teeth. Okay. Veterinary, because, working with veterinary dentists for a long time, they're like, we're not that afraid of bully sticks. We are really afraid of antlers and hooves. Anything. So the rule of thumb amongst veterinary dentists is any chew item that you cannot at least bend a little bit, that has a little bit of give, that you can bend it with your own hands, or you can dent it with a fingernail. If your fingernail can submerge into it a tiny bit, or there's enough give in that object to bend it. So here's me in my local awesome retail, pet retailers, is I'm going through all the bully sticks and I'm bending them. And I'm like, okay, this one's got some give. This one's really hard. I'm going to leave that just in case. I don't want to, broken tooth to deal with. So, they laugh at me because, they, lovingly laugh that, I'm going through bending everything. And so, but other items, tracheas and gullets and, sometimes braided things have a little more give too, all the braided gullets. Really, I even give my dog, the scapulas. I love like the bovine and elk, they call them elk straps or bovine, like the tendons, like those are really neat and they're thick and they really create some chewing stuff. There's so many items really that as long as there's a little bit of give. And the reason for that, by the way, is that and let me tell you one more thing. This is actually important too. is that also statistically, items that are long and thin, like an antler sort of, as opposed to a big old knuckle bone, marrow bone, statistically more likely for a long, slender thing to break a tooth. And I'll tell you why. And so that includes, by the way, nylon bones, nyla bones.
Nope.
Horrible, like very, way more risky than a bully stick. Like, we don't expect bully sticks to be a problem. Nylon bones, antlers, yes. And the reason is because the teeth that dogs use to chew those kinds of things, like obviously the teeth in the front, the canines, the fang teeth and the incisors, they're to grab stuff. Mm-hmm. The teeth to chew stuff and, masticate things are in the back. And we call them, the cheek teeth and the premolars and the molars. And so when they're gnawing on this big old knuckle bone, marrow bone or something that's got some girth to it, their jaw is so strong that when they have a lot of space between an open jaw and this small, slender item, they're coming down on that item with a crap ton of force. Mm-hmm. And if that item is stronger than their enamel, then the tooth's got to give, know? And so their enamel is very strong, but you're talking an antler, it's stronger. And so, but then you have that big bulky item and their jaws, it's right next to it and they're not coming down with quite, it's exactly. It's not coming down with that room for extra force. So it's way less likely, even if it's hard, if it's bulky, it's going to be less likely to actually damage a tooth, which is a pretty cool tidbit.
Well, okay, since we're talking about all of the good things that we want to chew, let's also talk about all of the things we don't want to chew. And what I tell my customers all the time is any heat-treated bone is a no-go. And so then, of course, I have to explain to them that means cured, that means cooked, that means any bone that has had heat applied is a no-go, because that's when we get the broken teeth and the fractures and all the things.
And they can splinter.
Right. And thank you. That's exactly it. I was like, that was great lead in, because that's something to really point out is that, of course, veterinarians have, historically taught all of our clients that, oh my God, you can't let your dog have bones and, chicken bones are so bad. And so, of course, for years as an integrative vet, I've always educated people that is cooked bones. Yes. There is a big difference. You cook a bone, you heat a bone, the texture changes and it turns brittle and it can splinter. And splintering bones are a risk. And a lot of dogs will get away with it. With chicken bone, they're not always going to pierce the gut. But I have certainly in 30 years of veterinarian, as a veterinarian, seen perforated esophagus, perforated intestine. And not only is that a big surgery, but it can be fatal, Yes. And so cooked bones, no-go. Raw bones, safe, but also be thinking about the size of the dog. Are they, never leave them alone with a chew object and leave the house or sure. whatever.
Yeah. And that's a big mistake most people do. Like, I don't care how safe you think the chew item is. The chew exactly. or the toy is. Yeah. They're like 3-year-olds. They could choke on a Cheerio. Please.
Exactly. Exactly.
Please watch
Observe
them. Yes.
and monitor your pets. Exactly. So there's always, that thought process in it, but there are, things that are on the safer list and the not safe list.
Sorry, Carly. I want to jump in with one more thing. This is so interesting. I'm sorry. I want to go back to enzymes real quick. And we've been throwing around that word, and I throw out that word, honestly, with all my customers. But what exactly does that mean? And as it applies to products, we all see the enzymatic sprays, toothpaste, the water additives. Do you think they work? And what ingredients should retailers look for or avoid?
That is awesome. Enzymes have so many great functions and, they can, clearly everybody's heard of digestive enzymes. So our digestive enzymes are helping us break our foods down to make the components in our food more bioavailable for our body to absorb and utilize them. So enzymes are very helpful on so many fronts. And there are a lot of enzymes that protect our body from bacteria and inflammation and cellular degradation and all that kind of stuff. And so I am a big fan of a lot of enzymatic products. There are some enzyme sprays, and other products for the mouth. Again, if they're eating a fresh food diet, and I don't actually utilize enzymes for the mouth as much as I do for some other areas of the body. I'll just give a shout out that I very routinely recommend enzymes for like ear infections and, the enzymatic, products that do that and help get rid of the bacteria. But this can work in the mouth too. And there are some enzyme sprays out there. I'm also a fan of using probiotics and prebiotics for the mouth. So I know that's a little different from enzymes, but just to toss that in there too. And so, the fresh diets are providing those natural viable enzymes, but using a product to introduce some enzymes, no downside to that. So.
Okay, good. Because I carry some.
Okay.
Good.
So, well then, in keeping with that then, are there big red flags that our retailers who sell these types of products, whether they're treats or water additives or powders or what have you, because there's everything under the sun for dental products. Are there any like major red flags that if you saw this ingredient or you saw this thing in these dental products that you as an integrative dental veterinarian would say, garbage, waste of money, don't sell it. It's like, it's just bogus claims, not any health.
Such a good question. And what I will include in the answer for that is that from the board certified veterinary dentist angle, because they're all, they're board certified, they're all into the research, show me the clinical study that proves that this water additive works, right? So, and they have the VOHC, Veterinary Oral Health Council.
Yeah.
You guys probably are well aware of that. If it's VOHC certified, doesn't mean that it's a great integrative product, because a lot of stuff that's VOHC certified has junky junk in there that you don't want, like red and blue.
Isn't that a pay to play?
But I think it's the NASC.
Okay, I thought I had heard that the VOHC was also pay to play, so I could pay and get that on my product.
That I don't know. That could be, but I'm not aware of that.
Okay.
But I do know that the VOHC needs to see some clinical data that it actually works to, and what they would probably consider safe. But what a conventional mindset would consider, safe, I'm looking at it and I'm going, well, there's some great ingredients in here. There's some, pomegranate and some inulin and all this stuff, but then there's red colored dye number
dioxide.
36 and blue, and I'm like, why'd you have to put the freaking dye in there? Like, I don't want toxins in my dental care product. So, there are some, but what I will say is that according to the VOHC and veterinary dentists that I speak to, there are little to no water additives that are clinically proven in respected studies. That not to say there's not stuff out there that works, because we know from an integrative side, things with green tea and chlorophyll, and we can get into the seaweed, the brown seaweed. There's all these things that have been studied, and brown seaweed is a whole other thing because it's just usually not a water additive, that truly does work and has clinical data and empirical results behind it. But as far as water additives, there are things that make sense, but maybe they're not proven clinically to decrease gingivitis scores, et cetera, et cetera. What I would say is there are prebiotic product that does have, clinical studies in
like
VOHC.
teeth?
I love teeth. I'm telling you. Do you guys carry that? Are you familiar with it?
I have carried it. It's a hard sell. It requires a lot of education to the public.
Yeah, and this might make it easier. So I would love to dig into that if that works for you guys, for your retailers to know about teeth and how to best educate, clients and
if people don't understand what we're saying, it's a product called TEEF.
Yeah, teeth for life.
Yeah, teeth for life. And there is a human version, by the way, they now call Protectin. It used to be Daily Dental Cares, and it's Protectin, which is the patented ingredient in there, which is a mix of prebiotics. And it is a water additive for dogs, but you can give it in other ways, because that's another little nuance of the discussion, is that, as you all know, a lot of small breed dogs, especially who eat fresh food diets, drink very little water. So people are like, how the heck am I supposed to give this? Yeah. So I'm like, put it in bone broth. Put it in raw goat milk, put it in. And if you didn't know this, it's kind of cool, because Dr. Emily Stein and Lindsay, the, teeth company, they actually did studies to show that because when they first released the product, it's like, put it in water, then you get 100% efficacy because there's no competition from the food for these prebiotics to work. And I can tell you how they work, but point being is putting in water, 100% efficacy. If you put it in bone broth or goat milk, it might be 90, 80%. If you put it in raw food, 70%. If you put it on kibble, you're down to 40% efficacy. And that's because there's so much darn sugar in kibble and carbs. And so the whole point of this prebiotic mix is there's 2 ingredients in there that are supporting the good guy bacteria to take over and flourish in the oral microbiome and protect the mouth and keep it happy. And those are vitamin B6 and L-arginine, are feeding the good guys. And then the last, and it's all natural ingredients, and the last active ingredient is a unique prebiotic fiber, cyclodextrin. It mimics sugar molecularly. As we talked about, pathogenic bacteria are sugar lovers. So it is even more attractive than sugar itself, this molecule, this prebiotic molecule. So the bad bacteria are like, whoa, that's the best sugar on the planet. I'm going for that. And they go bind to it and they can't use it for food and they literally starve and die off. So you have a reduction of bad bacteria, dying off, no antibiotics used. You haven't killed any good guys. You're supporting the good guys with the other ingredients. And voila, your oral microbiome is totally shifting to a healthier ratio. And one of the reasons, or the reason really, that I love it so darn much is because it flipping works.
I would say to any of our retailers who might be thinking, I've done the water additives and the dog won't drink the water, which obviously if that is the case, you get rid of the additive.
Right.
There is no taste with teeth, like literally no taste with teeth. No smell either. So you put that in the water and they don't even know it's there.
Right. And I will say 98% of pets don't know it's there. There is that 2% where people are like, with dogs or cats, I would have thought like any dog would not. But, on occasion, I'll have somebody tell me my dog won't drink that out of the water or my cat won't. And so the good news is, again, you can put it in anything else. I actually have some clients that will mix it in water or broth or whatever and literally just gently syringe it in the mouth. That is an option, is high maintenance, but some people will actually do that. I would just put it in something they'll drink. And if all else fails and they're on a raw food diet, just toss it on the food. You're still getting 70% efficacy. That's it's better than nothing. Better than not using it, so that's not a bad go. So there's lots of ways to get that in.
Okay. So I'm thinking you have been in the industry for 30 years. You likely have your, the ability to chat with lots of pet pros all over the place. I'm wondering if you can tell us, when we're kind of speaking about different myths, what are some of those outdated or unhelpful dental recommendations that you still hear in the industry that you really wish retailers would help re-educate pet parents and move away from?
So one of the things that I would, other than what we've already talked about, obviously, the hard food, the kibble, etc., all those good things, and the proper chew items. Another outdated myth would be that what you can see when you look in your pet's mouth, and and let's just start out by saying, for a lot of pets, it's even difficult for a pet parent to actually see into the mouth. Some pets are more tolerant to that than others. But if you're looking in the mouth and you see whatever level of dental imbalance that you can see, whether that's some tartar on the teeth, whether that's some gingivitis, some red swollen gums, that up to 60% of problems, or what we call pathology, are hidden below the gum line.
Right.
And so there is a lot going on in dental health that we cannot see with just a visual looking into the mouth. And so one of the myths too is that a teeth cleaning, simply just scaling and polishing the teeth, so gently, scraping and polishing the teeth to get the tartar off, and then you polish it to smooth it out so there isn't grooves in the enamel that let bacteria latch right back on and hang on. So that's a standard sort of cleaning. But if we're not probing under the gum line, and if there's any suspect areas with deeper, pockets, x-raying that, then we don't really know what's going on. And there are a lot of dogs that get their teeth cleaned that still have, and sometimes severe, periodontal disease going on under the gum line. And so what I love people to know is, just because the teeth appear clean doesn't necessarily mean that there's no dental disease or periodontal disease. So that's, a myth that I think is, really worth bringing up there too.
That's a good one though too, because, and I mean, I see it in Facebook groups all over the place. I don't know if it's the same for you guys in the States. In Canada, a dentistry for Zaner or other dogs, it's around $2,000.
Yeah, it's usually around 1,500 plus in
Yeah,
Dallas.
and I would agree.
Yeah. And so I guess, can you help not only all of our pet pros who are listening, but those who are also pet parents, which would be, all of them. What does that dentistry include? It's obviously not just cleaning then. What are we doing? Because I know people are outraged by $2,000 and then they don't want to do it, but we're impacting the overall health if we don't.
Well, and I also don't want to put my dog under anesthesia unnecessarily.
Yeah, I agree with that. But in order to do it the whole way,
exactly. And so there's that important line of distinction between unnecessary and, very, very helpful. So certainly we don't want to toss our pets under anesthesia if it's not of major value to do i.e., helpful, necessary. And so what I love to tell people is when you're going for a dentistry, I'm sorry it's expensive, and I'm going to tell you a little bit why, but I definitely advise against shopping for pricing for veterinary dentistries, because if somebody's doing it really cheap, there's a reason for that.
Yes. What are they
and
not
then
doing?
You're not getting, and then you are, and then to be quite frank, a lot of times in those scenarios, you are putting them under anesthesia unnecessarily because they're not getting any more with a dentistry done poorly. They're not getting any more value than you could just do with a non-anesthetic dentistry. Non-anesthetic dentistry, they're going to scrape and polish the teeth and call it a day. Done. Teeth are clean. But they're not able to do subgingival curetting under that space under the gum line that we call, the subgingival space. A normal periodontal pocket in a dog or a human is 0 to 3 millimeters. Anything deeper than 3 millimeters is a problem. You've got disease. Anything deeper than 6 millimeters, you can't even clean it with a curette. So you need a gingival flap or an extraction or something more fancy. And so the thing is that, that value that you're getting in a proper dentistry is they're probing just like they should be doing for us, our dental hygienist human side. We should be probing 6 spots on the circumference of every single tooth in the mouth to see if there's a pocket on the, the buccal side, which is the cheek side, the lingual side, the tongue side, forward, backward of the tooth. You need to find out if there's any pockets. And if there are any deep pockets, that tooth should be x-rayed. And so this is where you're getting this value. And, obviously to do that for a doggy or a cat, you have to put them under anesthesia. You can't do that. Mm-hmm. And so if we're just cleaning the teeth and waking them up and calling it a day, we haven't really given them much health value at all.
Well, the analogy that it comes to mind when you say that is if my car was full, to the roof of old takeout and empty pop cans and garbage, and I went through the car wash. On the outside, it looks good, right? But on the inside, it still smells like, a rat butt.
Right.
Yeah. So
it's a super good analogy. And one of the things I'll just tag into really quick there is the word periodontal, because I kind of wanted to just define this for everybody. The word periodontal means the deeper structures, below the gum line. So gingivitis is inflammation of the gums. Tartar, is calcified plaque on the teeth. The word periodontal means these deeper attachments on, around the root that are attaching, the tooth root into the jawbone, seating it in there. Once we get dental disease and infection below that gum line and ongoing inflammation below that gum line, we are now into periodontal disease. And that's where it's really, deeper, more severe, more significant, and communicating to the rest of the body, et cetera.
How old is too old for our furry guys to go under anesthesia to get a dentistry?
That's a great question. Yeah.
Phenomenal question. And so I'm going to answer that by starting out with anesthesiologists teach us in vet school, which is, I think, a cool phrase. Age is not a disease. Like, just because you're older doesn't mean you are, you have a deficient body that you can't. Yeah. And a lot of people know, your 90-year-old grandmother, people go under for hip replacements, they're breaking their hip. Like there are a lot of elderly people who go under, surgery and, do really well from lots of things. And not to say that that's 100% of the time with pets or humans, but just because you're older doesn't mean you can't handle anesthesia. Yeah, go ahead.
I did hear recently that every time you put your pet under anesthesia, it takes off about 6 months of their life. Is that something that you agree with or no?
No, I don't. And there's got to be so much data around that. And not that I'm an anesthesia lover and I love to put, everybody under anesthesia. But actually the best answer to that, Sherry, is living with periodontal disease will take more than 6 months off your life.
Yeah,
right.
Yeah.
So when you got to choose your battles, what I tell people is, yes, we should be judicious about anesthesia use, and you should shop for a very good doctor who is doing high quality anesthesia, and they have that pet on an EKG monitor, and they have that pet on an IV fluid drip, and they have that pet in a nice warm air blanket they call a bear hugger, because hypothermia is a big deal with anesthesia going, doing worse things to the body. More negatives are occurring if the body's not staying warm and the blood and the kidneys are not being perfused and the blood pressure's good and all that kind of stuff. So in a good quality hospital, all those bells and whistles are absolutely focused on. And when you do a cheap dentistry, then they're not.
Right. I want to circle back to the non-anesthetic cleanings, because I actually just started offering that in my store. I found a lady who is amazing. And I guess if they don't have inflamed gums and they don't have the periodontal disease yet, do you agree that non-anesthetic cleaning is still beneficial?
Such a great question. Nuances to that answer. If you have a very good hygienist, because some of them aren't as skilled, clearly, as others, and you have a very tolerant pet, I do think there can be some health value that they're getting out of that. But the limitations of it are that I would caution pet parents to just automatically thinking that, okay, the teeth were cleaned, so my pet's dental health is fine. Because I have seen pets come in and they have very clean teeth, yet they have gingival recession. You can literally see the roots, exposed roots in their mouth. You're like, oh my God, the gingiva's up like a half a centimeter higher than it should be, or lower if it's on the lower arcade. And I touch the tooth like, wow, this looks really diseased, but the teeth are really clean. So it's very odd that the teeth are this clean, and the tooth is mobile, and the tooth is moving. And so it's loose in those periodontal structures. So clearly there's a lot going on under the gum line, yet the teeth are really clean. So I've had pet parents go, well, I take them for cleaning all the time. And so, I thought they were healthy. And so I don't want to negate that there is health value to cleaning the teeth when it's done well. But I also want people to understand that that might bring on a sense of security of there's nothing going on under the gum line, when if you're getting cleanings done regularly, I mean, good for you. But that could mean there's things brewing under the gum line that you're not going to necessarily have the eyeball visual to say, ooh, there might be something going on, because the teeth are super clean.
And that's where a product like Teeth could help, because that is one of the only products that, from what I understand, can get under the gum line.
Such a good comment, and that'll tag me to tagging something else on to what I just said, so I don't cause any misunderstanding with people. You are right, Sherry, that Teeth, literally the prebiotic mix in there is grabbing at bacteria under the gum line where you can't even get with a brush, which is so exciting. I mean, I still tell people, if you can brush, please brush. That is absolutely helpful. But whether you can brush or not, adding teeth in the mix is beautiful, because your brush can't go below the gum line and the teeth can. The other thing, though, when people are getting anesthetic-free cleaning, that you really want to be looking for to sort of discern, does my pet need a full-on anesthetic dentistry or not? I mean, obviously, if the breath is bad and stuff like that, yes. But the clean teeth, like I said, if you're cleaning them, scaling and polishing them, then that could sort of, obscure that there's other things going on. Look at the gum line. So when I have seen, I didn't make this clarification, when I have seen pets that I found really bad periodontal disease with clean teeth, their gum line still told me the story. I looked at the gum line and I'm like, there's tooth recession, there's angry looking gums. But again, Some veterinarians who were trained a while ago still don't know that. And there's pets that have come to me where they've been to 2 other veterinarians. And I told this story recently on Inside Scoop, is that a Cavalier Charles Spaniel pet mom, brought me her doggie and said, she's 5 years old. I've had cavies all my life. She acts like she's 12. Her energy's super low. I've taken her to 2 other vets. Nobody can figure out what's going on. Her blood work is fine. And I look in the mouth and I'm like, oh my gosh, her teeth are really clean, but her gums are angry and she's got gingival recession. She's got a lot of dental disease. So she went to a board certified dentist and had multiple teeth removed. And a month later, I got to see her for follow-up and she's like, oh my God, I have my dog back and she's running around and all that kind of stuff. So the gums will tell the story, but put this way, 2 conventional veterinarians, like, I'm so happy that knowing dentistry makes me a better integrative veterinarian.
Yeah.
Or a better vet, period. But 2 conventional veterinarians missed that. They looked in the mouth and went, ooh, the teeth are clean. And it didn't even register for them that could be the cause of fatigue for this dog.
Right.
So really cool to know. So that's a good distinction. Whether you're getting the teeth cleaned or not with anesthetic, the gums will tell the story most often.
I do want to say that the lady that we have coming to do the non-anesthetic cleanings, I'm very impressed by her. She actually wants pictures of the teeth before we make the appointment, before we confirm it, because I think she does want to identify those things. And if it's beyond what she can do, then she refers them to a vet. So
perfect. So I right there, you telling me that, I would say I'm impressed as well, and that is a good, good skilled person who knows the value and the limitations of the service she can offer, and she's honing in on that and giving the best value.
Yeah,
and best
I don't think
guidance.
she's in it just for the buck. She's actually, there
good
to
for
help
you.
the
You
animals.
found a great person, and that's a wonderful thing for retailers to know is, if you're going to provide this service, make sure you've got somebody of that type of caliber, and then parents are getting educated well, and that pet is getting value.
I've got 2 things. I want to go back to the age of our pet going under anesthesia for a dentistry. So when they do the blood workup before our pets go in, that is supposed to kind of be our, yes, they're okay to go under. So what are they looking for specifically? And I mean, could those tests be wrong?
I'm glad you got us back there, because we kind of veered away from that. And that's an important part when I was talking about age is not a disease. But before we put anybody under anesthesia, whether they're young or older, it is always appropriate and necessary, in my opinion, to do what we call a pre-op workup, which is blood work, a standard CBC in chemistry, at the very minimum. And if the pet is older, is a predisposed breed to cardiac disease, or certainly has a history of, whatever, cardiac or pulmonary, chest x-rays before a procedure is also highly recommended, and sometimes even, required from some veterinary dentists. Because if a pet is going to have a problem under anesthesia, oftentimes it's cardiovascular related, cardiac related. So taking a chest x-ray doesn't guarantee that nothing will go wrong, but it certainly is a very good factor in determining who's a good anesthetic candidate and who is not. And then the blood work's really important too. And another thing with anesthesia that should be something that is very specifically monitored and thought about is kidneys under anesthesia. And so certainly when lab work is being done pre-op, we're looking at kidney values, liver values, really everything, the electrolytes, all the stuff in there, the white blood cell count, the platelets, all that kind of stuff. We are looking at to see, is this pet a good candidate for anesthesia right now, or should this procedure be delayed until this pet is at a better baseline and is healthier and is in, hopefully from my angle, homeostasis, and a good health. Now that said, there are pets that have disease that are still worthy candidates of going under anesthesia. So your blood work doesn't have to be perfect and pristine, but, obviously if there's something really severe, then we're going to hold off on that procedure and address that. And maybe that pet will never be a candidate for anesthesia. And then we just do the best we can with supporting dental health. But that's absolutely important. And the other thing that's important, like I said, is anesthesia when a pet is under a person, the perfusion to the kidneys is a big deal. So kidney health can suffer if they're under anesthesia for a long time and they're not on an IV drip, and that's perfusing the blood and the kidneys and everything like that. So I do want to tell people that veterinary dentists, because they are trained to do surgery all day long, I mean, that's what they do, they are very stringent on how long they will let a pet stay under anesthesia. And they will literally stage a procedure and say, okay, so sorry, your pet's mouth's a little bit of a disaster. There's a lot of work to do in here, but we're not going to do it all in one day because it's too much. And and anesthesiologists will teach us too, and this is a really good tidbit for everybody, is that short, multiple anesthesias are actually better than one long one. And most pet parents would intuitively go, I don't want my pet under anesthesia even once, let alone twice.
Yeah.
So can we take off the lump while we're doing the dental? Can we, this, that, and the other? And all the data shows the shorter amount of time you're under anesthesia, the better your body fares on the other side. So don't lump everything together. Don't try to do it all in one go, because it's actually much safer to split that up.
I'm guessing that works for us too.
Yep.
All right.
Yep.
Okay. I know that we're running short on time because Sherry is my little time manager here. This was something that I had heard, and actually it was Dr. Becker who said it on the Inside Scoop one time. And people look at me like I'm crazy, but I'm wondering if you have any knowledge on this, that sometimes when the furry guys are eating poop, it's because they're having a teeth issue. Have you ever heard that? Or could you
I've not heard that.
Yeah.
Dr. Becker talked about it. And so of course I was getting beat up on TikTok, as I often do, when I did a TikTok about like, why do our dogs eat poop? And people were coming back in the comments saying like, you're disgusting if your dog's eating poop, or my dog eats poop all the time and there's nothing wrong with him. And I'm like, have you ever wondered why your dog might be eating poop?
Yeah.
And maybe it has to do with his teeth. And because Dr. Becker had said, like, it's not kind of a natural instinct for them to eat the poop. Nobody wants to eat the poop, but they're doing it for a reason. And she said in some instances, it could be a dental issue. So I was wondering if you had, can you connect those dots?
I think I can. I love how you said that. I was going to say, I hadn't heard that specifically, just like Sherry said, like that specific link I hadn't heard. But I can connect the dots.
Okay.
That absolutely does make sense, because we know, and I love to tell, my clients too, is that there's usually a reason that the pet is doing that behavior. And, and some wild evolutionary behaviors may, people with, domestic pets may not, realize that there's a connection because that's what they would do evolutionarily. But we know that dogs will gravitate to eating poop if their microbiome is out of balance. And, the medical term for that, dysbiosis. Mm-hmm. We also know that the oral cavity has its own microbiome. Mm-hmm. So if they know that their mouth or their teeth are having problems, subconsciously or intuitively, they may be eating the poop to try to help the bacterial load in the mouth and or the gut. And here's the thing, of course, as we would know, the mouth and the gut share a lot. So the microbiome in the mouth is affecting the stomach, and vice versa. The microbiome in the stomach can be affecting the mouth. So that's the beautiful thing. In fact, Dr. Emily Stein of Teeth gets all excited about that because she's a microbiologist. And she's like, and that's the beauty of drinking this, because it sloshes around the mouth when they're drinking it, and it's helping the oral cavity microbiome, and then they swallow it. Yeah. And then it's helping the systemic, microbiome and the gut microbiome. So that is a really good question. And I do believe that those dots are easy to connect.
Okay, that's cool.
Makes sense. Wow.
Yeah, like I know when customers come in and they're like, my dog's all of a sudden eating poop all the time. He never used to do this. I'm like, have you got his teeth checked lately? And they're like, what? And I'm like, just a suspicion. I'm like, maybe go check your chompers.
And I will. I know this is a total tangent, and I'll be quick, Sherry. But when dogs eat weird stuff like that, I'm just going to share this because it's so phenomenal to me. This example is that I nutrient test my patients all the time. I want to see vitamin D levels and magnesium levels and omega-3 levels, because most pets and most humans are deficient in some really top critical nutrients that are easy to test for. And I've had people tell me my dog licks rocks, my dog eats dirt, my dog. And I once had someone tell me my dog is licking ash out of my fireplace. I think there's something wrong. And I said, I can pretty much guarantee you your dog is mineral deficient, but let's do a test. Magnesium was bottomed out. Like, I'm like, I knew it. There's a reason they're licking ash. Yeah. They're like, my body needs minerals. So anyways, it's a pretty cool little, thing of, that's empowered information of let's, take that cue and try to figure out the underlying reason.
Well, and like I've had that conversation numerous times with my customers when I talk about the power of our animals' instincts. Like, if you think about it, we domesticated them, but when Mother Nature did what she did to create them, she set them up with everything they needed to be able to survive. And so if they are instinctively looking to heal their body, there's a reason. Like, if they're all of a sudden licking ash out of a fireplace, it can't taste good. So like, why are they doing this? Right. So yeah, that's super interesting.
Wow. The brilliant intuitive mechanisms in the body. Yep.
Yes. I got one more question for you.
Oh, there you go. She just takes us over time again. Mm-hmm.
And then, if Carly, I know she'll have one more too, but, if a retailer wants to make their dental section more holistic and effective, what's the first thing they should add or change?
I would implement some of the things that we've, talked about already. Obviously, I didn't tell you about my dental products, so I guess that would be a good.
Yeah, this is a great time
to tell you that. And again, we talked about things that are enzyme based, things that are, probiotic based, things that are prebiotic based, because there's also probiotic sprays for the mouth. A prebiotic, obviously, like the teeth. Other things that have natural ingredients in them that can either be used as gingival rubs or on a toothbrush to help, wipe away that biofilm or just add good things into the mouth.
I've seen wipes. I've seen like teeth wipes. I always thought that was kind of silly, but I guess it could work.
Yeah, it absolutely can work. And as an interesting tidbit, Karen Becker, just because I was just on with dental, and she brought this up, and I thought this was a little cool nuance that she brought up, is that if you ever have somebody else brush your teeth for you, which most humans would never do, it feels really aggressive, even if they think they're being gentle. So she said, when you're brushing your pet's teeth, I always tell people, go gentle, go slow when you're first starting it out, do like 1 second and praise your pet. Like, don't go gonzo trying to get them to accept this or they're going to just hate it from the get-go. But also what she said is if you use a finger wipe or a finger brush, you have a little more tactile sense of how gentle or assertive you're being, as opposed to a brush you might not. And it might be better accepted and more comfortable and less stressful for the pet. Now, clearly, if the pet's trying to, chomp down on you and stuff, like, keep yourself safe. But the finger wipes and, finger brushes, do have some.
It's a great tip. Yeah.
Yeah, some potential in there. And then as far as things to use, I mean, I've loved to tell people for years that even just coconut oil by itself is a win.
That's what I tell people too. Yeah.
It's phenomenal for, gums. Clearly, it's also great for skin. I mean, it's just a good healing tool. And the lauric acid in coconut oil is naturally antimicrobial. It's, naturally anti-inflammatory. So what a beautiful thing for the mouth. I oil pull actually with my product pretty much every day. And oil pulling is that Ayurvedic tradition where you put a little coconut oil in your mouth and swish it around. Obviously, a pet's not going to do that, but even just applying it on is great. And then my product from my Dr. Katie's Remedies line, which most of my products to date in my line are homeopathic, other than my dental product, not a homeopathic blend, of course, but it is it's based a coconut oil base. It's a liquid product with some added things in for dental health. And the coconut oil that I use, I mean, everything's organic, of course, but the coconut oil that I use is Cocoa Therapy Triplex.
Nice.
And one of the reasons is because it comes in a liquid format and it still retains the lauric acid component. Most liquid coconut oils or MCT oils, you don't have that lauric acid. They're still helpful. They're still, there's no wrong in using them.
Right.
But their oil very specifically, not only high quality, but contains that extra component that's super helpful and medicinal. And then my blend also has essential oils, 2 essential oils. which is organic peppermint and organic myrrh. And peppermint, most people know, obviously freshens the breath, but it's also naturally antimicrobial. Myrrh has been used for centuries throughout, natural healing tools for gingival health, oral health. It's anti-inflammatory. It's antimicrobial as well. Myrrh's also been seen myrrh and frankincense to shrink masses and things like that. So I've actually had a couple people say, hey, there was a gingival mass in there that after I started using your product, it went away. And I was like, score.
Nice.
And then the last ingredient, yeah, right. And then the last ingredient is liquid trace minerals. So there are minerals in here as well. And I always tell people shake the bottle before you use it because the minerals are heavier and they will settle at the bottom. And so if you take it out with the dropper and taste it, it'll be mineral heavy and it tastes a little metallic. But if it's mixed up well or shook up before you take it, it's such a pleasant flavor. It is very low key on the essential oils. It's not overpowering. So it's good for cats and dogs. And just rubbing it on the gums or putting it on a toothbrush. And it is so helpful and
so I did not know that you had a line, and I'm not familiar with it, and I'm going to check it out. And I just wanted to tell retailers that it is available for wholesale. So
yes, thank you.
And in Canada too, right?
Yes, yes, it absolutely is in Canada, and we're going into the UK, which is very exciting. Yay. And so far, all my other remedies, I have 11 products, so my other 10 are homeopathic. And homeopathic, just as a quick note, is very different from herbal. And, the beauty of homeopathy is all of these natural sourced ingredients that are in homeopathy are diluted to a very, very tiny amount. So it's literally working energetically in the body, like the level of quantum energy in the body, which A, lends to its safety, high level of safe, it's very, very safe, but B, it doesn't interfere with anything else. So whether they're on herbs, lots of different formulas and Chinese herbs and all this stuff, or whether they're on pharmaceuticals, homeopathy is not going to interfere. So it's such a lovely add-in and it can work very quickly. Like a lot of other things take a little while for the body but because this is more energetic, like homeopathic remedies can create an instant change. And so there's a lot of great things about them, but I have several, within my line. And just to give you a little, background on homeopathy.
Well, and just so our retailers know, if myrrh was good enough for the baby Jesus by the three wise men,
amen, right? Amen. Can I get an amen? Exactly. Frankincense and myrrh. Biblical, history.
And it comes in a gold bottle.
Powerful oils.
I love frankincense. I put it in, like if I take a bath, that's the oil that I put in my bath. Yeah.
It is truly a holy oil. Yeah, it is. It is fantastic for so many things.
Well, okay. I think that we have covered a lot of good stuff. However, Pet Dental Month is upon us. It is 11 days away at this time. So if we wanted to give our retailers kind of that one quick, easy tip that they could do to get ready for Pet Dental Month, what would we do?
I would start out by looking in your pet's mouth. And, that's actually a really good lead into looking at, one of the beauties of even if you can't brush your pet's teeth, trying to just look in their mouth on a regular basis routinely is such a beautiful way to monitor your pet's health and their oral health. So start by, really recognizing, can I look in the mouth? Can I smell the breath? Can I see what needs there are? Either having a physical exam done by the veterinarian, fully realizing that up to 60% of problems may not be visible in an awake exam. And if you have access to a phenomenal non-anesthetic dental hygienist, like at Sherry's shop, that's another great way of getting somebody who really is educated in your pet's mouth and telling you, is there a problem deeper than what I can address for them today? And resourcing you to the correct place. So use them as a great resource too.
So my takeaway from that would be for our retailers is that start the conversation. Start the conversation with the pet parents that walk in your store about the importance of dental health and looking in our pet's mouth.
Love it. Yep.
Yeah.
And then how much the body, that the body is constantly affected by oral health. And if you're going to a veterinarian for your procedures, really shop them well and make sure they're, doing good dentistry job.
Mm-hmm.
So.
All right. If our listeners want to find out more about you and your products, where can they do that?
Thank you. So on social media, it is Dr. Katie Kangas. So my name, KatieKangas. And for my website, it's Dr. Katie's, no apostrophe, but plural, drkatie's.com.
Perfect. We will include that in our show notes as well, so that anybody who wants to find you or reach out or bring your products in can take a look and reach out to you. I want to thank you for spending time with us. I know that you are a busy lady, but I appreciate you sharing all of your knowledge with our listeners and helping us answer some questions as well.
It's been enlightening. This was fantastic. And I love
I have to go book Zahner's Dentistry.
You're very easy to understand, and I appreciate that.
Yeah.
Thank you, Sherry. And both of you, Carly and Sherry. My pleasure to be here today. What a fun, topic it is to talk about. And you are doing such a great service and value to people with offering all this ability for people to get such good information. So thank you for allowing me to be part of it.
No, thank you. All right, Pet Pros, until next time, bye-bye.
Bye.
All right, Pet Pro, that's it for this week.
Don't forget to follow, like, and subscribe.
Just hit all the buttons.
And if you want more, join us in the Indie Insider, our private Facebook group for pet pros.
Then you'll never miss the podcast that makes you sit, stay, and beg for more. The Pet Shop Girls.
Pet Shop Girls.
Okay, my Pet Pros, you got a minute? Let's talk about one of my favorite things to talk about. Training.
You know how hard it is to keep your team educated on all the different brands you carry.
Right? And that is where Retail.pet comes in. It's a free, easy-to-use platform where your staff can learn all about your favorite brands in one place.
No more chasing reps or random PDFs or remembering 5 million logins for each brand website. Retail Pet keeps your team sharp, your customers happy, and your sales strong.
Exactly. So if you're not using it yet, sign up at Retail.pet. It's made for pet retailers like us.